So in this video, we're going to go through the common struggles that people face when they've had a hip replacement, what to do, what to look out for, how to manage it. So anyone going through that, hopefully find it's useful. Now, look, hip replacements are so common in younger people, middle-aged, and the older generation as well. This is as a result of treating essentially hip arthritis. Hip arthritis is the #1 burden of hip pain worldwide. And as a result, we're lucky to have arguably probably the most advanced and most efficient hip surgery, or I should say orthopedic procedure, to help manage these as part of someone's essential recovery to improving their quality of life. However, it's a big procedure. It's a lot to go through, and sometimes, unfortunately, patients after the surgery are left to their own devices. It's not necessarily commonplace to often get really rigorous and robust physiotherapy afterwards, and honestly, it bothers me. It bothers me because this is such a big procedure. This is such a big thing that people go through. And unfortunately, there is so much that you are essentially on your own trying to figure out, is this normal? Is it not normal? Should I do this? Should I not do that? And that's why I am such a huge advocate for physio. Obviously, I'm biased. I'm a physio. I'm a hip physio. I couldn't be more biased at the information I'm trying to give you. But this isn't just made up stuff. This is hopefully helpful for you. And I really want to dive into this because look, the recovery from a hip replacement is huge, right? And if you're this will vary for sure, because you could be the general kind of, common age for hip replacement, right? You'd say is like 65 plus. This is a common theme. But when you look at the data, especially in the UK, that only makes up for almost about 70% of cases, which means there's a lot of people who are below the average age, in their 30s, in their 40s, in their 50s, that may well need to have a hip replacement, whether that's from a fracture, whether that's from AVN, some sort of trauma, some sort of infection, FAI syndrome, hip dysplasia, the list will go on. So you could be a young adult going to have a hip replacement, and the outcomes and the time frames of what your recovery is might differ in comparison to someone who might be 70s, 80s, but less active. Age doesn't make it look, age is age, right? Whether you're active or not active is the difference here. Whether you're kind of a fitter or healthier individual, those are the things that matters in regards to your recovery. However, what this video is about isn't about the specifics of the later stage recovery. This is for everybody. Anybody who is having a hip replacement, you're still going to have the same questions that you're going to ask as a result of what we're going to go through in this video. And that's the thing that I really want to dive into, because some of the most simple things that you will struggle with after surgery sometimes are the most important things that you need to overcome. Now, consider this, right? If you've got an arthritic hip, the most obvious thing that you're going to struggle to do is walk. Loads of people walk and they struggle. They have a limp. They have to adapt the way that they walk. In the worst case, sometimes they're even using a crutch. Now, over a period of time, your hip joint is going to change, right? So it means it's going to be stiffer and you can't use it as much. You're going to behave in a way that's trying to offset that pain and move in a way that's going to make you feel a little bit less problematic before surgery. So just because you've had that surgery, your brain doesn't immediately know that you can essentially move perfectly because your hip joint has gone, because all the stuff around it has been operated on. So it's going to be a bit uncomfortable. It is going to be a bit painful, but it's about understanding how you navigate that. When is it that you can start to try and really trust it and walk properly? Well, in the majority of cases, it's pretty much as soon as possible. That's why in the hospital, the physios are going to come in. They're going to get you out of bed. They're going to want you to walk. It is important to weight bear. It's important to walk normally as soon as possible. But you'll be using crutches or sticks, whatever it might be. Those walking aids are there to support you. You don't need to rush off them. The first few weeks, use them. Improve your quality of walking. Improve your ability to tolerate weight bearing. Don't rush to come off the sticks, because in the first couple of weeks, it's going to be a struggle. You're going to be walking around and thinking, can it do it? Can it tolerate it? Because it's such a big procedure. Like, you'll feel that it's uncomfortable, but that level of discomfort does not equate to your hip being weak. And that's really critical to understand. That hip can tolerate a lot. So you have to consider the fact that the sooner you walk, the better, but with more quality comes better improvement. So you use the sticks for those first few weeks and you'll wean off to one stick and you'll wean off to no sticks. The time frames are a bit fluid. You go by how well you feel you're improving. If by week 2 you're walking normally, no limp, good stability, good control, no hesitation to use it, for sure, you come off it. If you're week 5 and you're thinking, I need a stick for a bit longer, don't rush. It's a big procedure, but understand that it's normal. You just progress and gradual. And some of the things that you can do to actually facilitate your walking, to enable you to walk better, I'm going to go through now with a couple of simple exercises that you could try. Right, so I'm going to go through a couple of exercises, in particular for this bit, just to show you kind of some of my key bits when we're talking about gait re-education, because like I said, the walking can be a little bit of a nuisance really. So to practice your walking, this is one of the things that I often find really useful when it comes to gait re-education. What you want to do is, let's say for example in this situation, my operated leg is my left leg, right? It's a simple exercise, right? Take a small step forward with your left one, plant it, and as you're starting to lean your body weight over it and follow through, just reverse that movement. Because one of the things that often patients really struggle to do, or they're reluctant to do, is load the operated hip. So when you're walking, often what will happen is you might kind of have a bit of a hobble or a limp when you're trying to walk without crutches. But what I would say is just take your foot, plant it, try to walk over it, control it. What you don't want to do is like stomp your foot down and backwards. So it has to be a slow stance over and then reverse. Just repeat this movement over and over again. To start with, don't get me wrong, it'll be a bit quick, but you just want to try and control it. And this is perfect to do when you've got a crutch in the opposite hand to get your gait better early doors. And as that gets easier to do, then you would just follow through. You do one step, follow through to the other one, and then reverse that again. And that's a great skill to be able to do to teach someone to walk better. The other thing is, obviously, if you're struggling to weight bear through it, or you're not enjoying that ability to put your weight through because you're a bit conscious, a simple activity like holding on to something, whether it's a wall or a table, and doing some marching on the spot. Because whether or not you're lifting the operated leg up to actively load it into hip flexion, or you're having to balance to lift the opposite leg up, what you'll find is as you're trying to push through your operated one, your steps will be quite quick to start with. You'll do these kind of like quick marches because you're hesitant and also the hip is weak. But that's not the joint, those are the muscles around it. So slow marching on the spot, simple, but such an easy exercise to get used to quickly, because as you do that, and as your ability to stance on that leg increases and your ability to balance increases, well then so does your ability to take a stride with control. And those two things come hand in hand. Now the other thing that is a normal obvious struggle is stairs. You come out of hospital, you may well have done stairs in the hospital. That's a common discharge criteria at hospital. Go up and down stairs, good leg up, bad leg down. You get taught that there, which is fine. However, you cannot walk like that for the rest of your life up and down the stairs. At some point, you need to practice pushing through your operated leg the opposite way around. So if you're in hospital and they're teaching you good leg up, bad leg down, just because it's a bit easier to do, over a period of time, especially when you get into the back end of week 1 and week 2 into week 3, you need to be practicing using stairs normally. Many people have bilateral hip replacements, meaning that you don't have the luxury of doing one and the other because you've had both replaced at the same time, meaning that you can actually do that. This is very safe to do, but what do you think the biggest, have a think about this, right? What do you think the biggest limiting factor is for someone to use stairs normally after a hip replacement? Comment below if you agree with me. But it is not just the pain, it's the confidence. It's your confidence to trust it to push up. But that's so normal. You're human. You've had a big procedure. Of course you're going to be a little bit conscious. Of course you're going to think, should I do this? Should I not do this? It is part and parcel of the process of what you've had done. So don't beat yourself up about it, but practice. Practice in this case makes perfect. The more you practice the stairs normally, the more confident you get. And as a result of doing those exercises, you will become physically stronger. Those muscles will start to fire up, and all the things that you're probably struggling to do now, in a week or two will seem a lot easier. And that's really, honestly, it is so key, but it comes with practice. But one of the other things that you also need to consider is some of the information and bits of insight that you're told pre-operatively. So if you're at hospital and you're being told good leg up, bad leg down, it's easy to come home and think, well, that's how it should have been. I've been told this is what I'm meant to do. And for that period of time, it's fine. But what I want to do now is go through a couple of exercises to demonstrate just how you can improve both that physical and confidence element to enable you to use the stairs a little bit easier. The second exercise now, one of the other things I wanted to go through is obviously, like I mentioned, stairs. Now, again, we're going to stick to my left one being the operated hip. And often what you'll get told is good leg up, right? And then as you're coming down the stairs, you go bad leg down. So what we're going to do now is do the complete opposite. Because as you're starting to progress in those early stages in the first couple of weeks when you're wanting to use the stairs normally, pop your foot onto the bottom step. Now, before you start nailing all the stairs, you have hand on one banister, hand on the wall, step up, and then step down. Because what will happen is you're not going to be able to do some lovely, easy step up. It will be a hesitant, let me just get up and let me just get down. So the quality will look like this. And that's fine to start with. Use the assistance on the side, step up, and then slowly come back down. And get yourself good at doing this on the operated leg. Because the more you expose yourself to this, the more you do it repeatedly over and over and over again, the more your confidence will increase as well. And as you do that, your stability, the control of the hip will improve, and then you'll be able to use the stairs normally without really even thinking twice about it. Now, alongside that, we've also got the classic hip precautions, which often people are told, don't bend forward, don't pivot, don't sit in a chair which is too deep. And this is information that's often given to patients to try to mitigate hip dislocation. Now look, don't get me wrong. In some cases, people's hips do dislocate. I'm not going to lie. I'm going to be completely transparent, but we are talking about an absolute minority. Such a small percentage, and I'm talking less than 1% or 2% of patients that will suffer dislocations post-operatively. Now, the precautions are there for sure to mitigate that, but we know that the majority of patients don't have that risk. Now, when it comes to doing precautions, I wouldn't say go against them if that's what your surgeon has said, but you need to understand when you stop and how long you really have to do them for. Because the thing that we do know about hip precautions is when we're dealing with a patient group who are often a little bit conscious or anxious to use the hip too much post-operatively, being told not to do this or not to do that because of the risk of dislocation, well, what do you think that's going to do? It's going to make you more anxious. You're going to become fear avoidant, and you're going to try to avoid these behaviors or these movement patterns through fear of injuring it. So that's a big problem when the focus is so much on confidence and getting someone physically more able. So if you are being told hip precautions, just consider the fact and think, well, I understand I can't do it, but for how long? And a lot of the places nowadays, especially with hip arthroplasty specialists who are maybe at the forward thinking side of things, often don't even give hip precautions out. You take a pragmatic approach, you explain to the patient and just use common sense that some of these movements you're not going to want to do and you're not going to be able to do either. Now, let's think about quality of life, right? Let's think about the things that sometimes patients will struggle to do after the hip replacement. And one of those things is getting in and out of a car. Now, you would have struggled to do that probably even before surgery, sitting down with your leg first or kind of having to get in a certain way now because the hip doesn't allow you to move. And it's no different post-op. You will struggle to do those movements. But the whole purpose of this surgery isn't to restrict you more, it's to enable you to do these things with better ease. It's there to improve your quality of life, to enable you to thrive. So, well, how do we do that? that same movement pattern is impaired just because you've had surgery. It's still a bit stiff, it's still a bit uncomfortable. And I've got a couple of key exercises here I want to demonstrate just to help you. Now, as mentioned, one of the other things that you struggle with is often getting in and out of a car. And this is a simple tip that you can do as a bit of an exercise to try and move that muscle, move the hips, move those muscles in a way that will hopefully make it a little bit easier to do. Get something that's ankle high or shin high, whether it's a chair or a footstool. It doesn't have to be crazy to start with. But what the focus is going to be is the operated leg. We're going to aim to bring it up, abduct it and rotate it at the same time. Now, if you've got something this height, it's quite a nice starting point, because what we're trying to do, it's almost called opening the gate, right? You're trying to bring the leg up, open it and rotate it. It's very functional, very similar to what you would do day to day with loads of tasks, but it's difficult to do in those early stages, and it will feel tight, it will feel a bit uncomfortable, but it'll be completely safe to do. Find that marker, whether it's whatever I said, footstool or a chair. Probably will be too high to start with, but if you did have a chair, you can reach it and aim to get the bottom of your foot to the top of the underside of the chair, and you would just balance on the good leg, lift it up, pop it on there and bring it back down. The focus being every time to just really facilitate those movements that often you would do as soon as you're about to open a door and get into the car, or lunge for something, or go to pick something up. Just lift your leg up, rotate and out, rest and back down. And as it gets easier, well, all you'd need to do is find something a bit higher up or increase the ranges that you're pushing the hip through. Now, let's think about this, right? You've had a big orthopedic surgery, probably arguably one of the biggest ones, and your body needs to recover. Your body wants you to rest. Your body wants you just energize yourself and recover. Now, what's the most obvious thing that you do to recover? You sleep. Well, how can you sleep when you've got the scar, you've just had the surgery and you've been told don't move because you're going to do something to kind of damage it, or you're not allowed to sleep in a certain position? That's a struggle, because arguably if your sleep is impaired, well, your recovery in some capacity is going to be influenced negatively as well. So you need to consider the fact that for sure there are going to be certain things that you can't do, especially if this is your operated side, to lay on it, because it's going to potentially be sore, it's going to irritate it. It may even well be still a little bit early days since surgery, but you need to consider that that is not for a long period of time. Once the wound has healed, once it doesn't look as swollen, once things are starting to be a little bit less sensitive, and it's fine to palpate these structures, consider that this isn't the joint. These are the superficial structures that they've had to navigate through. That's the thing that's sore. So once everything looks like it's healing, the wound looks like it's closed up, and you're prodding and poking it and it's feeling okay, the position of your hip is pretty safe to start to modify your sleep positions. But to start with, if you're having to lay on your left hand side with a pillow between your legs so your knees don't move around too much, some might find that's a comfortable position. But you need to consider the fact that just because you've been advised to sleep in a certain position post-operatively, much like the precautions, much like the stairs and much like the crutches, these things are for a short period of time. Remember, after you've had this hip replacement, recovery can be quite quick, but so much of it is governed by someone's ability to be quite resilient and confident with what they're doing with their rehab. And as they do that, and as you progress, that discomfort, that pain, it all subsides, and you might be left with things that just feel a little bit stiff, a little bit tight. And that's when the stretches start to come in, because those movements that you've been avoiding post-op, those movements that you couldn't do before pre-operatively because your hip couldn't move, we need to start reintroducing those back. Your inability to cut your toenails, to wash your feet, to reach down to put your shoes and socks on, post-op is still going to be difficult, because you're not going to be able to bend over and rotate that hip because you've just had surgery. But you sure as hell are able to do it physically once you start to feed that into the rehab. But imagine someone who doesn't have physio post-operatively. This is part of why I put this new app together and why I'm really focused on trying to get better post-op rehab in the public domain, because arguably patients who have had the surgery to improve their quality of life and function will still be unable to do it post-operatively unless someone supports them to do that. Because the second you start to rotate it and it's uncomfortable and it feels stiff, first thing that comes to your head, am I damaging it? Is it safe? It is, but you need someone to be able to show you just how safe it is. And that's when the rehab starts to expose you to these things. That's when the rehab starts enabling you to do these movements. But again, you've got the same thing. You're making someone physically able to do it. And then as a result, you're making them a little bit more confident. All these things come hand in hand. And as a result of you improving your flexibility and your range of movement, all the little things that you couldn't do before, like housework, like the dishwasher, like the picking the washing up, all that stuff is important, and you will still struggle with it in the early stages post-operatively, but it's absolutely safe to start practicing it. And that's why sometimes some of the most simple and most effective rehab that I do with patients who aren't necessarily looking for some great recovery to sport, which a lot of my patients in the younger population who are trying to get back to an active lifestyle do, but some patients just want, I just want to be functional. I just want day to day my life to be easier. So your exercises for one might be different for the other. And for these ones, it might just be a case of trying to kneel down and pick the washing up, trying to tap that basket to start with. Simple things that reflect what they're going to try to do, but it's very safe. But in those early stages, it seems like a lifetime away. And unfortunately, the biggest limitation that I see with patients post-operatively who don't have physio is the fear to do stuff and the misperception or the misunderstanding that they're having a surgery that is there to replace the hip, but there's still going to be things that they're not allowed to do. And that's the biggest flaw. These hips are there, or I should say the hip replacement process is there to really enable. It's there to allow you to thrive and get the most out of it. So why would you have that surgery and come out the back of it and still avoid things? It doesn't quite sit well for me, that.